For paramedics responding to illicit drug poisonings, it's a race against time. For the past 4 years, paramedics with Squad 248 have found that race is easier won on bicycles.
I think being on a bike, we can provide faster service sometimes, especially in the downtown Eastside. It's sometimes hard to navigate, hard to get in. So with bikes, we can get in and out of the alleys a little bit easier.
Squad 1, we're in service and available.
Since 2017, they've been riding about 6 months out of the year.
How you doing, guys?
Good, yourself?
Each 11-hour shift sees them cover about 40 kilometers, toting a 45-kilogram bag. Over a recent 6-month span, they were called to over 350 overdoses, and now they might expand to a year-round program.
It's just better patient care. It's delivering better medical services. We need to adapt, and I think we need to adapt because the world around us is changing as well.
Good morning. How you doing, boss?
Meta and the other paramedics of 248 Squad ride through the streets, alleys, and parks of Vancouver's downtown Eastside. They are on the lookout for people in distress, but also get dispatched like a traditional ambulance. Today's first call is a drug toxicity event at Carnegie Community Center at Main and Hastings.
What it was a morphine pill.
A morphine pill, okay. Is it something you've used normally, or no way?
We're doing anywhere between kind of 2 to 6 overdose calls a day. Yeah, it can mean someone walks away and survives the overdose, and we get them to kind of the appropriate care that they need after that. And then there's always the negative outcome, where people just don't survive the outcome.
The patient in this case was saved thanks to bystanders giving him Narcan. 248 Squad checked him out and put him on a traditional ambulance to take him to a clinic.
Best of luck, sir.
Leaving them to patrol the alleys once more.
Clear. Hold up. Hello. Hello? Sir? It's the ambulance checking up on you. You good?
We're good, yeah.
Awesome. You have a good day, sir. No worries to apologize. We just want to make sure you're good.
Yeah, I'm good.
Cool.
The day's second call is not drug-related at all. It's a man having a diabetic incident. It's a person they're familiar with, and being on bikes helps build that familiarity.
Hello.
Being on the bike, it's quite low barrier, so we get to build those relationships with people. We get to see the same people over and over again. They get to know us, and we get to know them, their stories. We're kind of building those relationships over time.
Toxic illicit drugs have killed more than 7,000 British Columbians since the public health emergency was declared 5 years ago. Multiple groups on the downtown east side are working to stem the tide of these deaths, like the Overdose Prevention Society. Executive Director Sarah Blythe said 248 Squad works with her organization and others to share knowledge and best practices. It's welcome help, but more solutions are needed, like drug decriminalization, safe supply, and better housing and recovery options.
It's not really a humane situation that we remain in this crisis with a lot of the solutions that we have. There's a lot of things that we can actually do. It just needs government bravery at all levels to just get on it and do it.
Meta says he and his team are part of the solution, but they aren't the answer.
How much of a difference do you think you make?
I like to think we've made quite a big difference, judging by the daily gratitude we have from the public and people that we have dealt with. I like to think considerable difference.
Liam Britton, CBC News, Vancouver.